I want to bring in one of Dr. Talei's patients, Jennifer, who had this procedure. Now, I want to show you her before and after pictures, so take a look. And you can see such a dramatic difference and that it looks good. It looks natural. It's not these duck lips, as Dr. Talei has said. So, Jennifer, let me ask you, what do you think about the results?
It's honestly one of the best things I've ever done for my face. I was never really a candidate for lip filler just because of my anatomy alone. And every time I would do lip filler, it would just kind of duck me out. And over time, what I was noticing is that my face started to kind of change, but I didn't really understand why my face was changing. And I'm an injector myself. I work in this industry, and it really wasn't until I met Dr. Talei that he very gently pointed out that the lip filler had actually migrated into the area above my lip, which is the philtral column, and was kind of weighing down my lip and kind of just giving me a very older looking appearance. And once he dissolved it, I understood that my face had changed because of the filler migration. So I decided that, after seeing his before and after photos and realizing what this procedure was and how it was going to improve my aesthetic, I thought I should probably do this. This is a much better option for me than lip filler.
So Dr. Talei, we look at Jennifer, you've explained the procedure. I always have to ask this question because people at home want to know, what does something like this cost? And is it a one-time deal or is it subsequent work?
The cost varies where you are. Beverly Hills were obviously a little bit more expensive, but from what I've seen, there are very good practitioners here and there in the country, and the price tends to range between $2,500 and up to $20,000. The big benefit, though, is it's a 45-minute procedure. You heal from it. Then most people don't really need fillers afterwards. However, we do have our perfectionistic culture, and people do want to plump up always just a little bit more. The really nice thing is if you want to get filler after doing a lip lift, your lip is actually more receptive to it. So you can do fillers in a more natural, delicate way after having a lip lift because your lip is now up. It's not going to start jutting forward and pointing forward and looking ducky anymore. You can put smaller amounts and get a bigger change.
Exactly right. If I can just interject that, if you don't have lip to work with in the first place, you put filler in, there's nowhere else it can go but above the natural lip, and that's what's creating that quack and unnatural look. So if you don't have lip to begin with, you need to create some lip. After this, it's easier to add volume. And one thing I know Dr. Talei feels strongly about, as I do, the use of this lip lift in the aging face. So many women, in conjunction with a facelift, we don't realize that as we age, the lip, the mouth ages. It gets longer, the distance from your nose to your lip. You lose volume as well. So this procedure combined with a facelift is powerful.
Well, Dr. Talei, thank you so much for joining us. And Jen, thanks for showing us your great work. And thanks for keeping it natural. The rest of us who are watching appreciate that. And of course, for more information on Dr. Talei's modified lip lift and his procedure, just go to our website. It's all there, thedoctorstv.com.